What if some of the throat habits you've been doing for years are actually damaging your health every single day? Many seniors believe that a constant need to clear the throat, persistent mucus, a hoarse voice, or occasional difficulty swallowing are simply normal parts of aging. But what if they're not? What if some of these symptoms are warning signs that your throat is struggling and asking for help? As we grow older, the tissues of the throat become more delicate, saliva production may decrease, and the muscles involved in swallowing can become weaker. This makes the throat more vulnerable to irritation, inflammation, infection, and even serious complications if certain habits continue unchecked. In today's discussion, we're going to uncover 7 common mistakes many older adults make without realizing the harm they're causing. Some of these habits seem harmless, while others may have become part of your daily routine. Yet each one can contribute to chronic throat discomfort, voice problems, swallowing difficulties, and a reduced quality of life. Make sure you stay until the very end, because the final point is one of the most overlooked throat-damaging habits among seniors, and correcting it could dramatically improve your comfort, breathing, and overall throat health. One of the most common habits that can quietly damage your throat is constantly clearing it throughout the day. Many seniors do this without even thinking about it. You may feel a tickle, a small amount of mucus, or the sensation that something is stuck in your throat. Your immediate response is to clear it. While this may provide a few seconds of relief, the truth is that frequent throat clearing can actually make the problem worse. Every time you clear your throat forcefully, your vocal cords come together with significant pressure. Over time, this repeated impact can irritate the delicate tissues lining the throat and voice box, leading to inflammation, swelling, and increased sensitivity. What makes this habit particularly frustrating is that it often creates a vicious cycle. The more you clear your throat, the more irritated it becomes. The more irritated it becomes, the more mucus your body may produce as a protective response. This extra mucus then creates an even stronger urge to clear your throat again. Many seniors find themselves trapped in this cycle for months or even years without realizing they are contributing to the problem. In some cases, chronic throat clearing can lead to persistent hoarseness, vocal fatigue, soreness, and changes in voice quality that interfere with daily conversations. Several underlying conditions may also trigger frequent throat clearing, including postnasal drip, allergies, acid reflux, dehydration, and certain medications that cause dryness. Instead of repeatedly clearing your throat, try taking a small sip of water, swallowing gently, or practicing controlled breathing when the urge appears. Keeping your throat hydrated throughout the day can help reduce irritation and thin out mucus. Naturally, if throat clearing has become a constant habit or is accompanied by hoarseness, difficulty swallowing, or a persistent cough, it may be a sign that an underlying issue needs attention from a healthcare professional. Many seniors are surprised to learn that acid reflux does not always cause the classic burning sensation known as heartburn. In fact, a condition often called silent acid reflux can affect the throat and voice box without producing any noticeable stomach symptoms. This makes it easy to ignore and difficult to identify. When stomach acid repeatedly travels upward into the throat, it can irritate the delicate tissues that were never designed to handle such harsh substances. Over time, this irritation can lead to chronic throat discomfort, hoarseness, frequent coughing, excess mucus production, and the persistent feeling that something is stuck in the throat. As we age, the muscles that help keep stomach contents where they belong may become less effective. Certain medications, excess weight, large meals, and lying down too soon after eating can further increase the likelihood of reflux episodes. Unfortunately, many seniors assume that throat symptoms are simply part of aging, when the real cause may be ongoing acid exposure. Some people wake up with a sore throat, a raspy voice, or the need to clear their throat repeatedly throughout the day without realizing that acid reflux is contributing to these throat problems. Ignoring chronic acid reflux can allow inflammation to continue for months or even years. Persistent irritation may affect speaking, eating, and overall comfort. In some cases, long-term reflux can lead to more serious complications involving the throat and esophagus. The good news is that simple lifestyle adjustments can often make a significant difference. Eating smaller meals, avoiding late-night snacks, limiting trigger foods such as spicy or fatty meals, and remaining upright for several hours after eating can help reduce reflux episodes. Drinking enough water and maintaining a healthy weight may also provide relief. If symptoms persist despite these efforts, medical evaluation is important because effective treatments are available to protect the throat and improve quality of life. One of the most overlooked threats to throat health in seniors is not drinking enough water. As we age, the body's natural sense of thirst often becomes weaker, meaning many older adults may be dehydrated without even realizing it. At the same time, certain medications commonly prescribed for blood pressure, heart conditions, allergies, and other health concerns can contribute to fluid loss or cause dryness in the mouth and throat. The result is a throat that lacks the moisture it needs to function properly and protect itself from irritation. A healthy throat depends on adequate hydration. Moisture helps lubricate the tissues involved in speaking, swallowing, and breathing. When the throat becomes dry, mucus can become thicker and stickier, making it more difficult to clear naturally. This often creates the sensation that something is lodged in the throat, leading many seniors to cough or clear their throat repeatedly. Unfortunately, these actions can further irritate already sensitive tissues. Dryness can also make swallowing uncomfortable and increase the risk of minor injuries to the throat lining, especially when eating dry foods. Many people assume they are drinking enough because they have a few cups of tea or coffee throughout the day. However, relying primarily on caffeinated beverages may not provide the same hydration benefits as regular water. Signs of dehydration can include a dry mouth, sticky saliva, fatigue, dizziness, dark-colored urine, and persistent throat discomfort. Even mild dehydration can affect how your voice sounds and feels, causing hoarseness or vocal fatigue. Making hydration a daily priority can have a remarkable effect on throat comfort. Keeping a water bottle nearby, drinking small amounts regularly throughout the day, and increasing fluid intake during hot weather or illness can help maintain healthy moisture levels. Foods with high water content, such as fruits and vegetables, can also contribute to hydration. When the throat stays properly hydrated, mucus remains thinner, swallowing becomes easier, and the tissues are better protected from irritation and inflammation. Many seniors reach for cough drops, throat lozenges, or menthol products whenever they experience throat irritation, dryness, or the feeling of mucus buildup. While these products can provide temporary relief and may seem harmless, relying on them too often can sometimes create new problems. The cooling sensation produced by menthol can make the throat feel soothed for a short time, but it does not necessarily address the underlying cause of the irritation. In some cases, excessive use can actually contribute to ongoing dryness and discomfort. Menthol works by stimulating cold-sensitive receptors in the mouth and throat, creating a sensation of easier breathing and reduced irritation. However, this cooling effect can be misleading because it masks symptoms rather than treating them. Some people begin using cough drops throughout the day, believing they are helping their throat heal, when in reality they may be encouraging a cycle of dependency. Certain lozenges also contain ingredients that can dry the mouth, and a dry mouth often leads to a dry throat. When the protective moisture in the throat decreases, the tissues become more vulnerable to irritation and inflammation. Another concern is that frequent use of cough drops may delay recognition of an underlying problem. Chronic throat discomfort can be caused by allergies, acid reflux, postnasal drip, dehydration, medication side effects, or even voice strain. If these issues are not identified and addressed, symptoms may continue despite constant use of lozenges. Some products also contain significant amounts of sugar, which may not be ideal for individuals managing blood sugar levels or dental health concerns. Instead of automatically reaching for a cough drop every time your throat feels uncomfortable, it may be more beneficial to focus on hydration, identify possible triggers, and address the root cause of the irritation. Drinking water regularly, using a humidifier when the air is dry, and seeking medical advice for persistent symptoms can provide more lasting relief. When throat discomfort continues for weeks or becomes a regular part of daily life, it deserves closer attention rather than being repeatedly covered up with temporary soothing products. Many seniors do not realize how much strain they place on their throat and vocal cords during everyday conversations. Speaking too loudly, talking for long periods without rest, or forcing the voice to be heard over background noise can gradually damage the delicate structures inside the throat. As we age, the muscles that support the voice naturally lose some strength and flexibility. The vocal cords may become thinner, drier, and less resilient, making them more vulnerable to irritation and injury. What once felt effortless in younger years may now place significant stress on the voice box. One common reason seniors strain their voices is hearing loss. When it becomes harder to hear others, people often unconsciously begin speaking louder themselves. They may also raise their voice in crowded restaurants, family gatherings, or while watching television. Unfortunately, repeatedly pushing the voice beyond its comfortable range can cause swelling and inflammation of the vocal cords. Over time, this may lead to persistent hoarseness, vocal fatigue, throat soreness, and changes in voice quality. Some seniors notice that their voice becomes weaker by the end of the day, or that speaking for extended periods leaves their throat feeling tired and uncomfortable. Another issue is failing to give the voice enough time to recover. Just like any muscle in the body, the structures involved in speaking benefit from periods of rest. Continuous talking, especially when combined with dehydration or throat irritation, can increase the risk of ongoing vocal problems. Dry air, smoking, acid reflux, and frequent throat clearing can make voice strain even worse. Protecting your voice starts with simple habits. Speak at a comfortable volume whenever possible, stay hydrated throughout the day, and avoid shouting across rooms or over loud noise. If hearing difficulties are causing you to speak more forcefully, addressing those hearing issues may help reduce vocal strain. Taking short breaks during long conversations and using proper breath support while speaking can also ease pressure on the throat. A healthy voice is an important part of communication, independence, and overall quality of life as we grow older. Many older adults assume that occasional difficulty swallowing is simply a normal part of getting older, but this is a mistake that should never be ignored. While some changes in swallowing can occur with age, persistent or worsening swallowing problems may signal an underlying issue that requires attention. The medical term for difficulty swallowing is dysphagia, and it can affect both safety and quality of life. What may begin as a minor inconvenience can gradually develop into a serious concern if left unaddressed. Swallowing is a complex process that involves dozens of muscles and nerves working together in perfect coordination. When these muscles become weaker or less coordinated, food and liquids may not move smoothly from the mouth to the stomach. Seniors experiencing swallowing difficulties may notice that food feels stuck in the throat, meals take longer to finish, or they need to cough frequently while eating or drinking. Some individuals begin avoiding certain foods because they are difficult to swallow, while others unknowingly eat less, increasing the risk of poor nutrition and unintended weight loss. One of the greatest dangers associated with swallowing problems is aspiration. This occurs when food, liquids, or saliva accidentally enter the airway instead of traveling down the esophagus. Even small amounts can irritate the lungs and increase the risk of respiratory infections. In severe cases, aspiration can contribute to a serious condition known as aspiration pneumonia, which is a major health concern among older adults. Repeated choking episodes, coughing during meals, or a wet and gurgly voice after swallowing should never be dismissed. Several conditions can contribute to swallowing difficulties, including stroke, neurological disorders, acid reflux, muscle weakness, certain medications, and structural changes in the throat or esophagus. Early evaluation can help identify the cause and prevent complications. Treatment may include swallowing exercises, dietary modifications, hydration strategies, or medical management of underlying conditions. Paying attention to swallowing changes and seeking help promptly can protect both health and independence, while making eating a safer and more enjoyable experience. Here's the final conclusion for your speech. As we come to the end of today's discussion, remember that your throat plays a vital role in some of the most important activities of daily life. Speaking, swallowing, breathing, and connecting with the people you love. While aging naturally brings changes to the body, many throat problems are not simply the result of getting older. They are often linked to habits that can be corrected once we recognize them. Whether it's constantly clearing your throat, ignoring acid reflux, failing to stay hydrated, overusing cough drops, straining your voice, overlooking swallowing difficulties, or continuing exposure to harmful irritants, each of these habits can gradually take a toll on your throat health. The encouraging news is that small changes made today can lead to significant improvements in comfort, voice quality, swallowing function, and overall well-being. Your body has an incredible ability to heal and adapt when given the right support. By paying attention to warning signs, staying proactive about your health, and addressing problems early, you can help protect your throat for years to come. Don't wait until symptoms become severe before taking action. Listen to what your body is telling you and make throat health a priority. If you found this information helpful, take a moment to think about which of these habits may be affecting you right now. Even changing just one of them could make a meaningful difference in how you feel every day. Healthy aging is not about avoiding every challenge. It's about making informed choices that help you stay strong, comfortable, independent, and able to enjoy life to the fullest